As you know, there have been several reviews of the global response to the pandemic with many recommendations for strengthening global health security. They all recognize the need for better systems and tools, better financing, including for global public goods such as vaccines, better global governance.
The claim that the accord will cede power to WHO is quite simply false. It's fake news. Countries will decide what the accord says, and countries alone. And countries will implement the accord in line with their own national laws. No country will cede any sovereignty to WHO.
Any discussion of any of this is something that they do not really like, because they want to keep all of these negotiations in secret. They ideally would have gone through this whole process, adopt it, put it into play, let the period of time to reject it go past, and then down the road, when it's too late and they start implementing these rules and everybody goes, hey, what are you doing? They say, oh, well, we had this long period of time for you to say something and you didn't say anything.
Tamara Ugolini here with Rebel News to highlight how the World Health Organization, i.e. the WHO, has been actively seeking to transform its mandate since 2017. This is compounded as it seeks to amend legally binding international health regulations, otherwise known as the IHR, which were initially born out of the International Sanitary Regulations of 1951. As those regulations worked to improve sanitation, lessening disease incidences, and improving health outcomes, in 1969 the regulations were revamped and renamed with a broader scope now known as the IHR. Independent researcher James Roguski has been closely monitoring the WHO alongside its assemblies and working groups, and joined me previously to discuss how the working group on amendments to the international health regulations have been attempting to skirt their due process and ram through these amendments to legally binding international law without giving member states fair and due notice.
The idea here is that Article 55, in its basic purpose, is intended to support the principle of fair and due notice. And fair notice means that notice is timely and complete.
Roguski joins me for an update to further explain the role of the World Health Assembly. Have a look.
Well, the World Health Assembly is actually supposed to be the governing body of the World Health Organization. And they certainly aren't acting that way. And quite frankly, there's a lot of arguing going on in these negotiations. The World Health Assembly are the delegates from all of the many nations. And they are very unhappy with the World Health Organization because they have been putting forth proposed text for both what they now call the pandemic agreement, most people call it treaty, and the amendments to the international health regulations. And the Bureau, or the bureaucracy, is ignoring them. And they are not happy. And that's actually good news. Plus now, they have a deadline of January 27th, just a short period of time from now, that they are obligated, because of Article 55, to submit a final version 4 months in advance of the May meeting. Well, back in October, in public, in their meeting, they said they're not going to meet the deadline. Now, I think that is spectacular news, because if they don't submit it 4 months in advance, they don't get to make any changes in their May meeting. And I feel that that would be an enormous victory. Hey, come back in 25. We'll be here waiting for you. But you don't get to make any changes if we don't see a finished version by January 27th. 2024.
Yet back in May of 2022, the group didn't vote on any of this anyway, and the attendance was not robust enough to even conduct a vote. See, according to rule number 85 of the basic documents set out by the WHO, the, quote, presence of a majority of a committee shall, however, be required for a question to be put to a vote, end quote. Now, take a look here at the strange way in which the amendments were approved by Committee A in a sparsely attended meeting on May 27th, 2022.
To make sure that if the committee now ready to approve the draft resolutions contained in A75/A Conf 7 Revision 1. The financial and administrative implication of this resolution may be found in document A75A/Conf/7 at 1. I am asking you if the committee is ready to approve the draft resolution in question. I see no objection. Therefore, the resolution is adopted with these amendments. Therefore, I repeat, the resolution is approved with amendment.
Roguski calls this a conspiracy to violate international law.
They are actively conspiring to break the rules, break Article 55. They've scheduled meetings for February and April, and they have said, forget about, the 4-month rule. They're just going to keep negotiating right up to the last minute and submit a document that nobody's really had a chance to see. The other reason why I expect them to cheat is they lied and committed voting fraud in 2022. On May 28th, 2022, they published a document that said that they had adopted amendments to 5 articles of the International Health Regulations. Well, the only problem is when you watch the meeting that they claim that happened at, they never even mentioned it. So they claimed that these amendments were adopted by a vote of the Assembly, and they never had the vote.
The approval by Committee A on May 27th then lacked an overall vote on May 28th by the World Health Assembly's plenary meeting, and was the subject of contention by 12 members of the European Parliament, including MP Rob Roos, who became notorious for his questioning of Pfizer.
Heb ik de volgende vraag waar ik een duidelijk antwoord op wil. And I will speak in English so there are no misunderstandings. Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market.
They sent a letter to Director General of the WHO, Tedros, at the end of November 2023, requesting he send evidence of a vote, of this particular vote, as well as the exact number of members who were present at this vote. They gave him 48 hours to send an uninterrupted video, and if it was not produced, the signatories would declare the amendments null and void. No response was received from the European Union's request, so I sent a media request to the WHO asking for proof of a recorded vote on the IHR amendments from the May 28, 2022 World Health Assembly meeting. Daniel Epstein, Media Relations, responded with the following resolution and decisions annex document that adopted the amendments, but there was no evidence provided that a vote ever took place. So I dug up the 8th plenary session that adopted this resolution, and they didn't conduct a vote at all. This is how the World Health Assembly decided to adopt the amendments.
A resolution and a decision. The resolution is titled Proposed Amendment to International Health Regulations 2005. The decision is titled The Follow-up of the Political Declaration of the Third High-Level Meeting of the General Assembly on the Prevention and Control of non-communicable diseases. Is the Assembly in a position to adopt this resolution and this decision?
Je ne vois aucune objection.
I don't see any objections. And so there is a resolution and the decision are adopted. And the fifth report of Committee A is approved.
Well, when you shine light on cockroaches or rats, they tend to run for the darkness. And so any discussion of any of this is something that, they do not really like because they want to keep all of these negotiations in secret. They ideally would have gone through this whole process, adopt it, put it into play, let the period of time to reject it go past. And then, down the road, when it's too late and they start implementing these rules and everybody goes, hey, what are you doing? They say, oh, well, we had this long period of time for you to say something and you didn't say anything. And so that's why I'm speaking up now. Your silence is viewed as consent.
Roguski continues by urging Canadians to go to CanadianPetition.com, which redirects to a petition sponsored by Conservative MP Leslyn Lewis, brought forward by Burnaby, British Columbia resident Doug Porter, to exit the WHO and the UN completely.
Mr. Speaker, May 22nd to May 28th, representatives from 194 countries will meet in Geneva at the World Health Assembly to discuss the WHO Global Pandemic Treaty and to vote on amendments to the international health regulations. Why didn't this Prime Minister establish a public health inquiry into our COVID response before considering signing amendments to the international health regulations?
When you're in a relationship where the other party is lying and committing fraud and conspiring to violate international law, you can try to negotiate for better terms, or you could leave that relationship. And that's what I think the world needs to look at with these organizations. They are not serving the people, they are serving themselves and their masters.
Of course, Director General Tedros would have you believe that all of this is misinformation and fake news.
We continue to see misinformation on social media and in mainstream media about the pandemic accord that countries are now negotiating. The claim that the accord will cede power to WHO is quite simply false. It's fake news. Countries will decide what the accord says, and countries alone. And countries will implement the accord in line with their own national laws. No country will cede any sovereignty to WHO. If any politician, business person, or anyone at all is confused about what the pandemic accord is and isn't, we would be more than happy to discuss it and explain it.
If you appreciate this journalistic effort, then please head over to our website dedicated to this topic at exposethewho.com. There you can sign our petition. Don't forget to like, share, and subscribe to this report and others so that people can become aware and informed of what is happening at the WHO and the WHA. Thanks for your support at exposethewho.com.